So today I'd like to talk to you through a few answers to questions that we get asked on a regular basis here at Thoughts Physiotherapy. So when assessing someone in a physiotherapy assessment, we often have to see if we can reproduce the symptoms. We have to kind of move joints around, feel the muscles, press the muscles, stretch muscles, things like that as well. And in the process of trying to identify where the symptoms are coming from, sometimes it can be a little bit on the uncomfortable side. It shouldn't be super painful or anything like that, but it can cause some discomfort. Similarly, with the treatment, depending on the condition, depending on the area of the body, some treatments can be pain-free, some treatments can cause some discomfort. Things like shockwave are known to be a bit on the uncomfortable side, but once again, shouldn't be agonizing pain or anything like that at all. So the general rule of thumb is the sooner we can start treatment and the sooner you can get an accurate diagnosis, the better the outcome for things and the quicker we can get you on the road to recovery. That's not necessarily a blanket statement across all different conditions, but generally speaking, the earlier you can start treatment, the better. That may mean that treatment does need to vary a little bit. If you have, say, a really nasty ankle sprain, at the beginning of things, if you come in the day after it's happened, the treatment is going to look very different than if you come in for your first appointment 2 weeks down the line once the swelling is settled and the pain is settled. But generally speaking, the sooner you can get treatment, the better. So it's not just those super acute injuries that we see in physiotherapy. We see people from all walks of life with various different ailments. Some of them are new, some of them are old. I've lost count of how many times I've seen people coming in who had back pain for 5 years, 10 years, 20, 30 years going on. And given there are different things to consider if the pain's been going on for a very long period of time. For one, we very much want to know the history of all of it and the treatment that you may have had that led you to this point. But we can, at any stage of the journey, we can be involved and we can help provide value to get you back on the road to recovery. This one's always a bit of a more difficult question to ask, mostly because there's a certain degree of pattern recognition you can see with people that come in with very similar conditions and usually take a similar amount of time to improve, but it can be very variable even within that. I've had so many people that have basically crawled in with back pain on one session, and then by session number 2 they're like, I don't need you anymore, I think it's all good now. But then again, sometimes things can look very straightforward, and then it does take a lot longer than you think to get moving in the right direction. The general rule of thumb is the average patient has around about 5 sessions, but that can be very variable. That does depend on the condition, how long you've had it, what treatment's going to be involved, and and what your goals are with that as well. Once again, while this isn't a blanket statement, generally speaking, when an injury is relatively fresh, relatively new, lots of inflammation and swelling, ice is usually your friend at that stage of things. A little further down the line, when the inflammation is settled and you're just dealing with the pain and discomfort from that, it's usually more preferential to go towards heat. People tend to find that less at the moment with how hot it is at the moment as well. I hope you found this video useful. If you or anyone you know is suffering with any aches or pains, feel free to give us a call and we'll see what we can do to get you back on the road to recovery. Hope you have a nice day and take care.